Migraine headaches. More people suffer from migraines than asthma, diabetes, arthritis even.
The painful headaches can bring life to a standstill. More than 52% of those who suffer from migraines need bed rest, while 39% of migraine sufferers can continue to work with some difficulty.
Migraines can be genetic, but most migraine sufferers do not have to have a family history. So what exactly causes a migraine headache? How can we avoid it as we prepare for the stress of the holidays in particular? Joining us this morning is
I feel it coming on already.
Dr. Audrey Halpern. She's a neurologist and clinical assistant professor of neurology at NYU. Welcome to the show.
Thank you very much.
Are migraines curable?
Migraines are not curable. Migraines are treatable, and they're a chronic condition. Migraines are a disorder of the brain. And people who are susceptible to them for a lifetime. Typically what happens in a migraine is you get episodes of severe and debilitating headache, often accompanied by sensitivity to light and noise, nausea and vomiting, and there can be a whole host of associated symptoms.
What triggers it? Because a friend of mine, whenever she smells something, I guess she's allergic to fragrances, it sets off her migraines.
So there are a whole array of migraine triggers, and some of them people are not even aware of. The smells can be very potent triggers, but some of the most common triggers are things like stress, weather changes, drops in barometric pressure, changes in sleep patterns, changes in your eating habits as well.
I know these are awful. They're even like hell. Some people would prefer to die than suffer from these migraines. It's serious. What are you recommending? Treatment?
Well, I like to think about migraine treatment as in three different ways. There are traditional medical therapies that can help to prevent the frequency and severity of migraine and also decrease the pain associated with migraine. There are complementary and alternative and natural therapies that can be used, and then there are a lot of behavioral and lifestyle modifications that can be used
So
as
what
well.
can we do to prevent it?
We can use medications such as Botox injections or topiramate.
That's relatively new, the Botox.
The Botox was just recently approved by the FDA for chronic migraine sufferers, people suffering from migraines more than 15 days per month.
Are there risks that are associated with that?
There are always risks associated with medications and injections, but they are very minimal.
You mentioned, okay, Botox. And what about lifestyle adjustments? You mentioned lifestyle.
Yeah, there are some really important things that people can do to help prevent their migraines. One of the most important things is good sleep hygiene. That means going to sleep at the same time every night and waking up at the same time every morning. Don't skip meals. And avoiding certain things like red wine and certain food triggers.
And what about medications? Anything besides like the Botox? Are there any pills that you can take too?
Sure, there are medications like antidepressant medications, blood pressure medications that can help prevent, but then there are also pain medications that can be taken aside from the over-the-counter medications such as sumatriptan, which are migraine specific. One of the things that's really important to understand that for people out there to know about is that when you start taking too many pain medications, like things like ibuprofen and Tylenol, if you take them more than a couple times a week, you can actually make your headaches worse.
Really?
Yeah, exactly, and that causes what we call chronic migraines. So it's really important for people to know that if you're having frequent headaches, don't just keep that bottle of ibuprofen in your purse and pop them all day. You really need to see a doctor.
That's pretty wild. I had no idea. Boy.
Yeah, most people don't know. And you need to find a doctor who will work with you on really multimodality treatment, help you learn how to sleep better, get exercise, eat healthy, and also prescribe you the right medications.
Sleep hygiene, going to bed at the same time, waking up at the same time.
That's impossible.
Right.
I know.
It's really difficult, especially around the holiday times when we're taking vacation and we're choosing to sleep in. That's actually the wrong thing to do. You should wake up when you normally would wake up and not skip your morning coffee, because that can also cause a headache.
4:30 in the morning.
Hey, don't complain.
Enjoy your holiday.
I'm not.
They treat her like a queen around here.
That's right. Listen, he doesn't get headaches. He gives them. Just so you know.
You get it?
Some give and some get,
that was funny the first time you said it 2 years ago. Dr. Audrey Halpern, we thank you so much.
I'm taking my road to my jokes to the Catskills.
Get myfoxny.com.